lingual marginal ridge. Because it's a canine, or it's a central, or it's a lateral, it will be a mesial marginal ridge. This is on the occlusal. Okay, so this is a marginal ridge only, mesial or distal marginal ridge. Alright? Now if I have a line all the way around here, on the cusp ridges and marginal ridges, that will be your occlusal table.
Yes, that's a good one, Julio. Yeah.
It's going to be on it.
Okay.
Alright, now if I have a big triangle in between, right here on top of the pit, mesial triangle fossa. There we go. What will be over here? Triangle fossa. There we go. Now we're talking. Alright, now let's move to this one. Okay, upper, lower. What your number will be?
29.
20. Are you sure?
No.
Okay. Anybody else? No. The other ones. What number was this one? It's upper or lower? Upper. This is your mesial side. What number it is?
12.
Say it. 5. 5. It's the mesial marginal of the groove. It's number 5. First premolar, remember. Okay, now this one is a what number? What is this one right here? Close. It's a mesial, but it's a mesial lingual developmental groove. On the upper is a mesial marginal developmental groove. It goes on the proximal. On the lower is a mesial lingual. It's coming to the lingual side, towards the lingual. That makes a mesial lingual developmental groove. It's on the lower. And you can see that the lingual cast is a little bit lower than the vocal. Okay, what your number will be if this is your mesial side? 21. 21. All right. This is the same thing as the upper, so I'm not going to spend too much time on this one. Let's go to this one. Which one is this one now? Are you sure? Are you sure it's 29? Number 20. Why? There we go. This is the Y shape. You have 3 cusps. Which one is this one? Are we vocal cusp? Mesiolingual cusp? Distolingual cusp. So the mesiolingual cusp is the second biggest. And this is the Y shape.
Why?
Why? It's Y shape. Now, if you have a Y shape, you have how many pits?
3.
How many pits? 3. So which one will be this one? Mesial pit and central pit. Okay, on top of the pit we have a big triangle. What will be this one? Fossa. Mesial triangle fossa. What will be this one over here? It's a regular fossa. What will be over here? Just central fossa. It's not triangular. It's just a central fossa on that one. All right. Now we have cusp ridges on the cusp tips. What will be this one over here? It's a cusp ridge of the vocal cusp. What will be this one over here? Of the mesiolingual cusp. What will be this one over here? This is the cusp ridge of the vocal cusp. What will be this one right here? This is the cusp ridge of the mesiolingual cusp. What will be this one over here? This is the cusp ridge of the histolingual cusp. Everybody with me? All right, what will be this one over here? That That will be the mesial cast ridge of the distal lingual cast. All right, what will be this one over here? The lingual cast ridge of the vocal cast. What will be this one? Lingual cast ridge of the mesial lingual cast. Lingual cast ridge of the distal lingual cast. And what about this one right here? It's a line angle. What line angle it is? It's a mesial lingual cast of the
Wait, mesial lingual line angle.
mesial line angle of the.
Mesial lingual cast.
Yes, because we have a
Same thing, but a link distal.
on the distal lingual cast. Everybody got that? Yes. Okay, this is a line angle, so that would be your mesial line angle of the mesial lingual cast, because we have a mesial line angle of the distal lingual cast. So what is this one over here? And we have a of the mesial lingual cast. All right, what would be this one right here? It's a developmental depression. So it will be your lingual developmental depression of the mesial lingual cast. All right. Now let's go between the inside. Now we're going between the two pits all the way to the cast tip. What will be that one? And what side it is? So that will be your vocal triangular ridge. What will be this one over here? Mesial lingual triangular ridge. What will be this one? There we go. Now what will be this over here?
Mesial buccal triangular ridge?
No, another name. This is between the triangular ridge and the marginal ridge, right here. The triangular fossa will be right on top of the pit.
Say it.
Close.
Mesial buccal.
It's a mesial. Anybody else? Right here. This is the marginal ridge, this is the pit, this is the triangular ridge, vocal triangular ridge. Mesial marginal ridge, right here, on top of, close to the mesial cast ridge. What is this one right here?
Is it the incline plane?
It's an incline plane on one side.
Mesial.
Mesial. So that would be your mesial vocal incline plane. What would be this one over here? Distal vocal incline plane. Now we have another small one here. Distal lingual incline plane,
Of the
distal lingual cast. Because we have a distal lingual incline plane of the mesial lingual cast.
Do we have 45 seconds?
Okay, I tell you already, I'm gonna try not to go to that long ones, okay? But you need to know that that's gonna be kind of on the boards, so you need to know those. All right, now what would be this one over here? With 3 points, point angle, what point angle would be this one? Mesial lingual occlusal point angle of the mesial lingual cast. Why? Exactly, you have another mesial lingual.
Can you abbreviate that on the?
Yes, you can. Yes, you can.
ML?
Yes, you can. As long as you have everything on it, we're gonna count it. Okay, so this will be your mesial occlusal point angle of the distal lingual cast. All right. Now, what will be this one right here? Okay, and what will be this one over here only? Not yet.
Marginal groove?
Not yet.
Okay.
This one is coming over here. It's just what we use in lingual groove.
Just lingual groove.
If it goes across all the way to the lingual, that will be your lingual developmental groove.
Okay. When you notice a marginal development groove?
Okay, that one when it goes across the marginal ridge. Okay, but this one is on the lingual groove only, because it's only the lingual side that goes. Okay, so this is, if you go only to the between the ridges, it's just a groove. That will be just a lingual groove, but if it goes across all the way to the lingual side, then will be that developmental groove. Okay? All right, now if I have only one line coming this way, cast ridge
of the
of the distal lingual cast. If I have a triangle big time between the tips all the way to the cast tip, the lingual triangular ridge or distal lingual triangular ridge. Either one is okay. Okay, everybody with me? All right. Now let's go to this one. All right. Now what will be this one right here? Distal lingual marginal ridge. This will be your medial marginal ridge. What will be this one? It's a line right here only. The lingual cast ridge of the, just the lingual cast ridge, because it's only one cast. Lingual cast ridge. What will be this one? Vocal cast ridge. The distal cast ridge. Medial cast ridge. Now what will be this over here? What side is? Mesio. Lingual fossa. And this one? Distal lingual fossa. What will be this one over here? Singular. All right. On this side, what will be this one? It will be a line angle. On what side it is? That will be mesial line angle or mesiolabial line angle because it's only on the canines and the anteriors. What will be this one? There we go. And this one? Labial cast ridge is okay, or vocal cast ridge is okay. What will be this one right here? Nope. The fossa is on the depression, the developmental depression. What side is? Okay. Mesiolabial or mesiovocal, developmental depression. And this one? Depression. There we go.
So how do you know the difference between a depression and a fossa?
The fossa is on the lingual, or it's going to be in the occlusal. The depression, the developmental depression is on the vocal side only. Okay? And then if it's on the occlusal too, if you have it on this one, it's going to be incline plane. All right, now let's go to this one is going to be easier than that one. All right, then let's switch to teeth. I think I'm able to see these ones. Won't be able to see them. Can you see that one? Can you tell me the number? Everybody agree with that? Yeah, for this you gotta see it closer, I guess you gotta hold it. Where do you have a problem with the teeth? So I can take one of them. Upper or lower? Upper and lower canines. All right. On the, let's see. Okay, on the uppers, what we can see on the uppers?
Where?
The where, where's the upper, where's supposed to be the where on the uppers?
On the lingual side?
On the lingual side. Okay, what else we supposed to have on the uppers? It's a big cingulum that you're gonna have. You're gonna have a big cingulum, you have a big cast ridge on it. Okay, the cast tip is gonna be cast on the middle. If you look at on the proximal, the cast tip is gonna be in the middle and the root is gonna be in the middle. And it's gonna be like a little diamond shape if you look for the proximal view. All right. The lower is going to be more oval. If you look at it for the proximal view, it's going to be more to the lingual side. And you're gonna have like a little concave in the lingual side. You're gonna have so much of a castration on the lingual. And it's gonna be pointier on the lower more than the upper. But then again, you're gonna have both of them. I guess you gotta see the teeth on those. What else do you see? The wear on the lower, you're gonna see more on the vocal side. Because the upper is overlapping the lowers. The single is gonna be barely there. It's gonna be more developed on the upper more than the upper, the lowers. Singular is on the upper, yeah. It's more developed on the uppers.
And how you just do left and right?
Left and right, the cast ridges. The mesial cast ridge is shorter on both of them, but I mean you can dictate which one is the mesial, which one is the distal.
What about when there's a lot of wear on it?
Well, that
Give us
too.
a lot of those.
Then you gotta look at the line angles. The mesial line angles is straighter with the root, and the line angle is kind of straighter. You're gonna see that the distal line angle is shorter, because that's where the ridge is gonna be longer on the top.
Okay,
So the line angle is gonna be shorter, the mesial line angle is gonna be longer.
and straighter.
Exactly.
Say it again?
The line angles on the distal is gonna be shorter. That you can dictate which one is the distal and the mesial line angles. And then when you go to the lingual side, it's gonna be the other way around. The mesial marginal ridge is gonna be shorter than the distal,
That's on upper and lower?
upper and lower. And then the roots, where the roots supposed to go? Remember what we're talking about? Most of the roots goes to the distal, except for one. Which one? The mandibular is supposed to be towards the mesial, but not always.
Julio,
And the lower mandibular.
just don't use that as a reference
Exactly.
because it's just,
Not
we don't
always.
have all the different shapes, but sometimes it's gonna be, because just because it's going to the distal is not necessarily enough.
Not always.
So try to use things that are gonna be consistent, okay, that constantly is gonna be always the same. Don't use things that are very inconsistent. So for example, what Julio said, for example,
Here.
Obviously, all the canines, it doesn't matter to distinguish in between upper and lower, all the canines are gonna have the cusp more towards the mesial, right? From the vocal view. Always remember that, right? So that's gonna tell you if it's right or left. So that's your best reference to decide if it's right or left, okay? Don't think of anything else to say if it's right or left is the position of the cusp. The mesial arm or the mesial margin of that cusp is always going to be short, and the distal is going to be longer, and the point angle and the line angle is going to be like really rounded. And you have seen that, you have been waxing up that, and it's very obvious. So just focus on that thing. It's very easy to decide if it's mesial or distal. It's very evident, always, okay? Now, upper or lower. Actually, Julio and I were selecting some teeth for your for Friday, and we selected the most confusing ones for you guys, of course. No, but honestly, there was a couple of them that we didn't know if it was upper or lower. So that's probably the most difficult one thing to identify. So a couple of things. From the buccolingual view, for the occlusal view, buccolingually, the width buccolingually, the cusp, where is the position of the cusp? So in the upper one, is it more towards the buccal or more towards the lingual? From the occlusal view, okay, again, I'm having my canine like this, I'm looking at my canine like this, and I have my cusp. And if I see the cusp, if I see too much of the facial or too much of the lingual, meaning it's in the center or it's more towards the buccal, okay? So on the upper canine, the cusp, is it more buccal or more towards the center? Buccal. So that would be, if you cannot tell exactly if it's upper or lower, that would be one thing that you can pay attention to. So there are a couple of things, that's one, but let's start with the most obvious one, okay? Most of the time, the lower canine, the walls, from the buccal view, they're gonna be more divergent, right? For the upper than for the lower. For the lower is more straight. Okay, that's one thing. That's the most obvious thing. But still, sometimes you have a really, because we have from different patients, not from the same patient, there's really big lowers and very small uppers, so that can be confusing. So one rule first is, again, the mesial and distal wall from the vocal view, it can be more divergent for the maxillary and more straight for the mandibular. Does that make sense? All right. Second thing, anatomically, it's not going to be more that pronounced on the facial and especially on the lingual. On the mandibular, you're not going to see the distal and mesial fossa like you see on the maxilla. All right, have you seen that before? So it's going to be more flat, and you cannot see the anatomy that detail. All right, so pay attention on that. So a couple of things again. Anatomy on the lingual. All right, you can see the ridge, the lingual ridge on the maxillary, but not so much on the mandibular. Okay, all right. So what else? Again, from the facial view, you can see the walls, the mesial and distal, like this on the maxillary and like this on the mandibular. All right? So it's slimmer. So in comparison, so another thing is in comparison with the root. That's a good tip. From the root, it's gonna be more like an apple on a stick. The maxillary, the lower is more kind of the same, a little bit wider than the root, but not that much. Okay, are you following me? Okay, so that's one. But sometimes when we were having problems identifying like the last thing, like the last thing that you can decide is the position from the occlusal view, the position of the cusp. If it's to facial or it's more on the middle. Is it this in the middle? It means it's a lower canine. If it's more towards the facial, it's a maxillary canine. Okay, so that's it is more difficult to identify from upper to lower than from mesial to distal. Is a no-brainer. All right, mesial to distal. Remember, I'm sorry, left to right is a no-brainer. Okay, upper and lower again is just narrower from the facial view. Okay, and in relation with the root is going to be more divergent, the maxillary than the mandibular. Anything else that you could say?
No.
And on the facial as well, it's not that pronounced. I mean, the anatomy, you're not going to see those depressions in between the marginal ridges. You're not going to see that much on the mandibular one. Okay? So do not use the inclination of the apex of the root, because it can be mesial or distal, and that will get you confused. Okay? Any other on the canine? You're good on the canine? Then, once I mentioned the canine, go to the first premolar. Remember, the first maxillary premolar is the only one that has the longest slope towards the mesial and not the distal. From the so the cusp position from the facial view is more towards the distal, right? Just remember that part to identify if it's left or right. But the most obvious thing to identify if it's right or left is the mesial marginal developmental
Marginal. Mesial marginal developmental
It's
groove.
almost the end of the day. I'm tired. Okay.
What's the second one?
Wait, what?
The first one is the mesial marginal developmental groove. What's the second one? Second one. Of the first premolar.
The second thing that you have to pay attention.
Two roots. Okay. Second one is two roots.
And sometimes has three roots. If you have three roots, for sure it's a first premolar, maxillary first premolar.
What's the third one? What's the third one? What's the third one on the first premolar? Yeah, which one? The vocal cast? Or the distal? The lingual cast?
Towards
the
mesial.
mesial or in the middle? That's the only one that goes towards the distal, the vocal cast. Okay? What else? One more. Or? Say that again? exactly. The vocal canals are a little bit higher than the lingual. So you're turning it to the anterior to the posterior. So the vocal canals got to be a little bit higher than the lingual. What else? 5. Still have more. Marginal ridges. So let's say marginal ridge. Yes. It means the marginal ridge is going to be higher. It means the marginal ridge is going to be lower. Because you're turning into the posteriors now. Okay? Okay?
But in general, that's a very easy one to identify. Just with the mesial marginal developmental groove.
Let's go to the second premolar. What we have on the second premolar? Not yet.
No.
This is
The
upper.
maxillary.
What we have on the second premolar?
Maxillary.
They're not, like, the cusps,
Both of them go towards.
Let's put it that way. You already know how a first premolar looks like, right? Very similar. It's very similar with no mesial marginal developmental groove. That's the first one.
So
But
means
you don't have that.
Two marginal ridges about the same height.
Two marginal ridges is more symmetrical, and it's going to be the two marginal ridges pretty much at the same at the same level, as well as the two cusps, buccal and lingual, pretty much at the same size, the same height. Okay, that would be, they're pretty much very similar, but with those differences. Okay, so you don't have the pressure on the mesial. That's it. And finally, the roots. You don't have two roots on the second premolar. You have only one. Okay, so that's very, very important.
Vocal cast toward the mesial. Lingual cast toward the mesial or in the middle. And the first one was toward the distal on the vocal cast.
But I don't want to go to more details because I don't want to make it more confusing. I want you to identify for this exercise that you're going to have on Friday, as well as for your boards. You don't want to know every single detail because you're going to go nuts and start getting confused. Just get all the tips, the little things that is going to help you to identify if it's a first premolar, second premolar. So you're good with the differences in between first and second premolar? Are you good to know how to identify if it's a right or left? Right? Okay. Now, so let's move to the first molar.
No, yet.
You don't want to go to all the uppers?
No, because I mean, it's just anterior.
Oh, I'm so sorry.
Right.
Well,
Don't go to the middle.
I'm sorry that you're not overachievers. All right? Okay, so mandibulars. Okay.
Go to
The first premolar, it's a piece of cake. I mean, that's the one that you're always gonna get right. Because it's the one that the lingual cusp is what? It's super small. It's very, very tiny, right? So that makes you identify if it's a lower first premolar, is that the lingual cusp is really, really short. Really short. I'm talking about 2 to 3 millimeters shorter than the buccal. All right? So everybody gets that one right. Now, how do you identify if it's right or left? There are two things that you can identify. On the crown, on the occlusal. From the facial view. What's the difference in between, can you identify between right or left? The cusp is more towards the mesial. All right? That's it. That's very, very simple, just like the canines. Okay? And the second thing, you don't really need to know it because if you already have the cusp, but sometimes the cusp is like, it looks kind of in the middle and you're not so sure. The other thing that you can confirm is what direction of the apex of the root. Which way is going to go? Distal. So that's the other way that you can identify, okay? That's it. I don't want you to get more than that. Right? So just summarizing, to identify the piece of first premolar, very, very short lingual cusp. If it's right or left, the position of the cusp. It has to be more towards the mesial. And finally, the direction of the apex is going to go to the distal. That's it. Second premolar.
Oh, wait. You have another one.
Okay, Julio, whatever.
Because I think that's what we want to do. Because you have the mesial marginal developmental groove on the upper. You have the lingual developmental groove right over. Okay, but it's on towards the lingual side. Okay, so that way you know that which one is the mesial side, but it's on the lingual side. No, it's a mesial lingual because it starts the lingual. Okay, the upper is the one that goes to our roots. It's called the proximal side. All right. Now, what else do you have too on the first premolar? You're gonna lose like a more like premolar too. So the cast ridges and everything is gonna lose similar to like a canine. Okay, so cast ridge is gonna be shorter. The cast ridge is gonna be longer. My angle is gonna be similar to straighter. This one is gonna be not rounder. It's gonna look like a premolar. I mean, like a canine. All right. Now let's move to the second premolar. What we have in the second premolar? We have three types. We have the A shape, the U shape, and the Y shape.
H, U, and Y?
Yes. So we have the Y shape. We have three casts. Well, the first, the biggest one is the vocal cast. The second biggest, the mesiolingual cast. All right. So the distal lingual is the smallest one. That's the Y shape. The A shape is going to be two casts only, and you have nice shape from the pits. You're going to have two groups, real nice on both sides. The U shape is going to be like it's biting to you, and you're going to have a bunch of supplementary grooves, and it's like a U shape next to the pits. And the cast tip is going to be the same height. But now the difference between the upper and the lower is that it's going to be wider mesiodistal. Meanwhile, the upper is wider vocal lingual. All right? Everybody got that? Okay, any questions? Second premolar? Okay, second premolar, most of it, the height of the cast tip is about the same. Marginal ridge is about the same. All right? And now vocal cast, lingual cast is toward the mesial, or the lingual cast is going to be in the middle. So both of them are supposed to be toward the mesial. One root. And also the first premolar, you can have only one root. It's going to be two roots, maybe fused together. So it may be one root, but two together, fused together. All right. Anything else?